My name is Lulseged Yimer. I'm from Ethiopia. I'm working as the executive director of an Ethiopia local NGO called as Action for Integrated Sustainable Development Association, AISDA. AISDA has been working for the last 20 years in different parts of Ethiopia, especially in the area where there's a recurrent droughts and conflict, the pastoral area in Afar. And also, recently, we have also been operating in Amhara region and in Tigray region. So while there was a northern conflict, we expanded our intervention area to Tigray. So our program area mainly focus on humanitarian responses and development and recovery. So the programs, the specific programs are like health education, wash protection, and gender, natural resource conservation and management, and food security. These are the main program areas that we are implementing. In Ethiopia, there are numerous humanitarian recovery and development programs in sectors such as WASH, health education and protection that have received huge support from USAID. Specifically to my organization, AISDA had 3 active health and education projects that recently lost the USAID funding. These projects were specifically assisting the IDPs, internally displaced people, and other pastoral communities which were affected by conflict and drought. This project is focused on the most vulnerable group of people, including women, children, and girls. The health project, especially the health project, focused on strengthening the community system to enhance the reproductive, maternal, newborn, and child nutrition health services and outcomes. It really works to improve the health literacy and community engagement. And it was also building the capacity of the non-state actors like the private clinics and the private pharmacies, and also strengthening the overall health accountability system. It was benefiting approximately 390,000 individuals who were really affected by conflict and drought. On the other hand, the 2 education projects were really improving the learning and well-being of the crisis-affected girls and boys. These projects were providing access to quality education, inclusive education, safe learning opportunities for more than 30,500 internally displaced and refugee children, and also they were supporting or creating access to quality play-based education for preschool children, which are aged between 3 and 6. So overall, this project significantly impacted our ability to support all these people, all these IDPs, children, the women, the girls. For the second question, the impacts that resulted from the cut of the project, you see, this project really has had, this funding really had a profound and far-reaching impact on the communities we serve, particularly, as I said, the internally displaced people and the vulnerable population that we focus on. For instance, the health project was really instrumental in enhancing the RMNCH, the reproductive, the maternal, the newborn child health service. And now we are unable to continue and to strengthen the community health system, which means approximately, as I said, more than 390 individuals will no longer have access to improve the health literacy program, because this will lead to gap in the local health service delivery. And it will also erode the community trust in the health service at grassroots level. And it also aggravates the existing challenges that this community have. On the other hand, the education projects, you see, they were designed to improve the learning opportunities of 30,500 IDPs and the refugee children. So the funding cut means that many of these children will lose access to quality and inclusive and self-learning environment. This really could result in increased school dropout, particularly among the vulnerable groups like the girls, who may face additional barriers to education in the pastoralist context, in the IDP context, in the refuge context. These projects were also, they were also providing vital psychosocial support to these children because they are affected by conflict and they are displaced, they are IDPs, they are refugees. So the absence of such program may leave those beneficiary children without crucial emotional psychosocial support system. And this potentially leads to long-term mental and health issue. Overall, both the health and the education projects were playing a crucial role in fostering the community stability and resilience. So losing this program could aggravate a feeling of insecurity and hopelessness among displaced populations. It may be more challenging for such people to recover from impacts of conflict and drought, recurrent drought. To reply for the third question, you see, we heard about the funding cuts. First, we heard through social medias and TV news that the U.S. president signed executive order to suspend all the U.S. foreign aid. We were shocked. You see, then we received a stop work order from the prime recipients. We are sub-recipients. We are implementing programs at the community level, at the grassroots level. So the sub-recipients immediately wrote an email of a stop work order. So that was how we hear about that decision. What will happen? What will happen to those projects that lost funding? To the projects, to our projects that lost funding, the immediate consequence of losing this fund, the USAID funding for this specific projects, will be a significant reduction in maybe in the health and education service for those IDPs we are reaching out, the refugees, especially the women, the girls, and the children in the region where we implement all these three projects. And this will negatively impact all these affected people. And it will impact the well-being and their future opportunity of these affected people, especially the IDPs and the refugee children and girls. Further, it will risk undermining the community resilience and prolonged poverty, and maybe instability within the region and in the countrywide too. We are not owed any money. We have been instructed not to undertake any activities, but we may be allowed to expend some for staff salary for a period of 2 months, maybe. There will be no reimbursement for other expenses. This is what we already told. So we owe no money at hand. Regarding people's idea in my country about the America's role in the world, the cuts and the funding from USAID could really change how people feel. Many of the people, my people, who were just depending on the American help for things like healthcare, schools, or education, which and other important services might feel, you see, very let down, or they may feel a sense of abandonment. They may feel that they are abandoned. This could make maybe this can make them wonder if the U.S. really cares about affected people, cares about the humanity and development of Ethiopia, or if America just cares more about its own political goals than helping people over humanitarian needs, maybe. And because of this, people in Ethiopia might start to think less positively about the US, especially if they see the funding cuts are a sign. Maybe if they feel that it's a sign that Americans uh, don't understand or care about their problems. And this may further influence our internal policy. You see, like internal policy of Ethiopia, maybe Ethiopia may start looking to other countries for help, look for other allies which could change who its friends are and affect the future relationship. You see, because the community's feeling might have impact on the policy, the internal policy. But on the other hand, even though it might be less likely in a country with over 4.4 million people displaced currently from their homes, for a country like a constant problem with drought and conflict, and where many people, like more than 69% of the people are poor in different ways, you see, this funding cuts maybe could still make Ethiopians feel more likely, more it could make them feel that they need to rely on themselves. This might encourage us to focus more on using the money and the skills that we have, and to help each other, like through local giving, through community philanthropy, instead of always depending on help from other countries. But this is less likely because of those lots of problems that I mentioned. Thank you, and over. Yeah, I'm based here in Addis, because our headquarters is here in Addis, but we are operating in Afar, Amhara, and Tigray, especially in the pastoralist community in the lowland in the Afar.